Welcome to PSY 318, Study Session 7, Substance Abuse Disorders. Introduction. In this lecture, substance use disorders are discussed with emphasis on maladaptive patterns of substance use. The categories of substance people often misuse are also listed according to DSM-4. Many people use drugs to change their level of awareness, mood, and feelings. Sometimes the drugs are not prescribed by a qualified medical practitioner. They are self-medicated and self-administered. This is what is referred to as drug abuse, which could lead to maladaptive behavior. Drug independence and addiction. Objectives. At the end of this lecture, you should be able to 1. Distinguish between substance use and substance use disorders. 2. Describe the maladaptive of behavior due to substance misuse. And 3. Differentiate the category of substance people often misuse. Pretest. 1. Distinguish between substance use and substance use disorders. 2. Describe the maladaptive patterns of substance misuse. 3. Differentiate the categories of substance people often misuse. Content. Drug use is not a new problem. Humans have used drugs for thousands of years to cure illness, alleviate pain, and relieve mental suffering. A drug is defined as any substance other than food that affects our bodies and mind. It did not be a medicine or be illegal. The term substance is now frequently used in place of drug, in part because many people fail to see that such substances as alcohol, tobacco, and caffeine are drugs too. When a person ingests a substance, whether it is alcohol, cocaine, marijuana, or some forms of medications, trillions of powerful molecules surge through the bloodstream and into the brain. Once there, the molecules set off a series of biochemical events that disturb the normal operation of the brain and body. The substance misuse may lead to various kinds of abnormal functioning. Some substances can also lead to long-term problems. People who regularly ingest them may develop maladaptive patterns of behavior and changes in their body physical response. The maladaptive patterns may include substance abuse. This is maladaptive pattern of substance use leading to clinical significant impairment or distress. People may excessively rely on the drug and in doing so damage their family and social relationships, function poor at work, or put themselves and others in danger. This is indicated by one or more of the following occurring within 1 year. 1. Recurrent substance use resulting in failure to fulfill major obligations at work, school, or home. 2. Recurrent substance use in situations in which it is physically hazardous. 3. Recurrent substance-related legal problems. 4. Substances use that continues despite it causing or increasing persistent social or interpersonal problems. Substance dependence. This is a more advanced maladaptive pattern of substance use, leading to significant impairment or distress. Substance dependence is also known as addiction. In this pattern, people not only abuse the drug but also center their lives on it and perhaps acquire a physical dependence on it, marked by a tolerance for it, withdrawal symptoms, or both. Substance dependence is manifested by at least 3 of the following within 1 year period. 1. Tolerance. 2. Withdrawal. 3. Substance often take in larger amounts over a longer period than was intended. 4. Persistent desire for substance or unsuccessful efforts to control substance use. 5. Considerable time spent trying to obtain, use, or recover from substance. 6. Substance use in place of important activities. 7. Substance use that continues despite it causing or increased persistent physical or psychological problems. Withdrawal. Symptoms consist of unpleasant and even dangerous symptoms. Cramps, anxiety attacks, sweating, and nausea that occur when individuals suddenly stop taking or can't cut back on drug. Categories. The substance people misuse fall into several categories. They are examined below. 1. Depressants. Depressants slow the activity of the central nervous system. It includes alcohol, sedative, hypnotic drugs, and opioids. 2. Alcohol is any beverage that contains ethyl alcohol, including beer, wine, and liquor. 3. Sedative hypnotic drug. A drug used in low dose to reduce anxiety and in higher dose to help people sleep. The sedative hypnotic drug includes barbiturates and benzodiazepines. 3. Opioids. This is a highly addictive substance made from the soap of opium poppy. The drugs derived from it are heroin, morphine, and endorphins. Stimulants. These are substances that increase the activity of the control nervous system, resulting in increased blood pressure and heart rate, greater alertness, and speed up behavior and thinking. Amphetamine is a stimulant drug that is manufactured in the laboratory. Caffeine. The world's most widely used stimulant, most often consumed in coffee. The rest is consumed in tea from the tea leaf, cola from cola nut, chocolate from cocoa bean, and numerous prescriptions and over-the-counter medications such as Excedrin. Hallucinogens. This includes LSD, lysergic acid, diethylamide, developed by Albert Hofmann in 1938. LSD is a hallucinogenic drug derived from ergot alkaloids. Cannabis drugs. These are drugs produced from varieties of hemp plants, Cannabis sativa. They cause a mixture of hallucinogenic, depressant, and stimulant effect. The most powerful of them is hashish. The weaker ones include marijuana. Marijuana, one of the cannabis drugs derived from the buds, crushed leaves, and flowering tubes of hemp plants, Cannabis sativa. It is a commonly used illicit drug and causes mild perceptual change and feelings of well-being. Polysubstance-related disorder. A long-term pattern of maladaptive behavior centered on abuse of or dependence on a combination of drugs. Polysubstance-related disorder are becoming as common as individual substances-related disorders. Multiple drug use has led to the death of thousands of people, especially American celebrities. Elvis Presley, delicate balancing act of stimulant and depressant, eventually killed him. This is the same for many others. Psychological, social, and biological factors contribute to the development of substance use disorder. See Lecture 2. A diagnosis of antisocial personality disorder is a risk factor drug and alcohol addiction. Genetic factor may also influence vulnerability to addiction. Many approaches have been used to treat substance-related disorders, including psychodynamic, cognitive behavioral, biological, and sociocultural therapies. Today, the treatments are typically used in combinations on both outpatient and inpatient basis. Moreover, some people recover without any intervention at all, while others recover and then relapse, and still others fail to improve. Adejumo, 2007, suggested the following in the treatment of drug abuse. 1. Reassure the patient that it is possible to stop abusing substances or drugs. 2. Link the patient up with alcohol or narcotic among many groups. 3. It may be necessary to enter a patient treatment center. 4. Encourage patient detoxification for about 2 weeks. 5. Identify and deal with psychosocial problems emerging from drug use. Substance abuse shows a high rate of comorbidity with personality disorder depression. anxiety, and schizophrenia. There is often a developmental progression with children who have a conduct disorder, beginning experimentation with drugs, then progressing with children who have a conduct disorder, beginning experimentation with drugs, then progressing to antisocial personality disorder and drug addiction. Although this developmental pattern is more common among males, it can also occur in females. The following case history of many illustrates the childhood origins of substance abuse. Substance abuse in children. Case study. Mary was the second of 3 children born into a middle-class family. Her father was a sales representative for a furniture company, and her mother worked part-time as a hairstylist. Mary was a happy, energetic child who did well in school and had a broad circle of friends. At the age of 9, she won a state award for her skills in jazz dance. Her family and friends attended her performance and celebrated her award. When Mary was 12, she traveled with a group of friends to participate in a dance competition in another state. Her group came in second place at a party following the competition. Take 2. Mary met preteens from many areas of the country. After she returned home, Mary began to correspond with a boy named Larry, whom she had met at the party. Mary's parents had some apprehension about her new friends, primarily because she was 14 years old, but they decided not to express their reservations. 1 year later, when Mary was 13, Larry came to visit friends in her hometown. Her parents said she should not go, and Mary became furious. She sneaked out of the house that evening to attend the party and didn't return until 2 a.m. That evening marked the beginning of a series of behavioral problems. At 14, Mary began to wear makeup and clothes that made her look much older than she was. She repeatedly violated her curfew and her grades began to drop. One night, she came home at 12 a.m. with alcohol on her breath. Her parents grounded her and limited her privileges, but nothing seemed to affect Mary's behavior. When she was 15, Mary stole money from her parents and she began smoking marijuana. Mary's first experience was an illegal drug, marijuana, was preceded by the use of a legal drug, alcohol. During this transitional period, there was an increase in her non-compliance. This is a very typical developmental pattern. However, for most youngsters, the behavioral problems begin to subside in late adolescence, and there is no progression to adult substance abuse. It is only a minority of teens who progress to a drug addiction. Summary. The term substance is now frequently used in the place of drug. Substance misuse may lead to various kinds of abnormal functioning. The maladaptive patterns of substance misuse mainly include substance abuse and substance dependence. Substance abuse shows a high rate of comorbidity with personality disorders. There is often a developmental progression with children who have a conduct disorder, beginning experimentation with drugs. The progression to antisocial personality disorder and drug addiction. The substances people misuse fall into several categories such as depressants, stimulants, hallucinogens, and cannabis drugs. Depressants include alcohol, sedative hypnotic drugs, and opioids. Stimulants include cocaine, amphetamines, caffeine, and nicotine. Hallucinogens include cocaine, amphetamines, caffeine, and nicotine. Cannabis drugs include hashish and marijuana. Polysubstance-related disorder is a long-term pattern of maladaptive behavior centered on abuse of or dependence on a combination of drugs. Post-test. 1. The maladaptive patterns of substance misuse may include DASH. 2. Substance abuse shows a high rate of comorbidity with DASH. 3. Depressants include DASH, DASH, and DASH. 4. Stimulants include DASH, 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 and DASH. 5. LSD is derived from DASH. 6. Hashish and marijuana are derived from DASH. 7. Polysubstance-related disorder is centered on DASH. 8. Withdrawal symptoms include DASH, mention 3, DASH, and DASH. 9. Alcohol is any beverage that contains DASH. End of study session 7. Thank you for listening.